Hello, I am Dr. Krishna Chaitanya, Medical Oncologist. I work as Assistant Professor at MNJ Cancer Hospital and Regional Cancer Center. I take care of pediatric oncology cases. I'll briefly explain what are the signs and symptoms to be noted in children who are suffering with cancer. If you detect these signs and symptoms early, so that we can diagnose the disease early and cure them completely. In children, the most common cancers are blood cancers. Blood cancers means either a leukemia or a lymphoma. Leukemia means where you have an abnormal count in your TLC, the total leukocyte count, or WBC count. The presentations will be because the WBCs are the policemen of the body that will control the immunity in the body. When there is abnormality in your white blood cells, you are prone for repeated infections. When a child is becoming repeatedly sick, he may be suffering with some immunity problem. For them, we need to check the complete blood picture to see the abnormal WBCs and the hemoglobin levels and the platelet count. When the hemoglobin levels are very low, the child will be seen very sick and fatigued, tired very easily. Because of the platelet abnormality, they'll have a bleeding manifestations. It can be on the skin, from the nose, from the mouth, or in the motion or urine. Wherever the bleeding manifestations occur, we have to assess for the platelet count and abnormality in the complete blood picture. These are common manifestations in leukemias. Coming to lymphomas, which is a category in blood cancers, in lymphomas you will get the nodes, lymphadenopathy. It's called lymphadenopathy. The lymph nodes will get enlarged and are seen as nodules or masses over the neck, axilla, or in the abdomen. Wherever you see a mass within the child, that need to be examined properly and tested for lymphoma or other type of tumors. When you take other tumors apart from blood cancers, it depends on the organ from where the tumor arises. For example, if it is from the liver or kidney or from the adrenal gland or within the abdomen, any muscle, the child will present with abdominal bloating, abdominal distension, abdominal mass, or alteration in the bowel habits or abdominal pain. So any of the symptoms shouldn't be neglected and should be tested for any pathology within the abdomen. And other tumors like bone sarcomas, where the tumor arises from the bone, you will see the lump or the mass arising from the any part of in the body, like any arms or back. Generally is seen in the limbs only, upper limbs and lower limbs. If the child has any abnormality in the brain, like brain tumors are also very common in children, they'll present with seizures, that is fits or headache or weakness of the part of the body or not growing up properly. Any of the symptoms can occur in brain tumors which needs to be evaluated further. The key point is in children, if you diagnose them very early, the cure rates are 100% for any type of tumor. And the treatment complications also very less in early stage tumors compared to advanced stage tumors. So we should remember the common signs and symptoms in children to diagnose them early and cure them early, giving them the good